One of the biggest misconceptions people have about pain is that it suddenly appears. It doesn't. Pain is more like a light dimmer than a light switch. It slowly gets dialed up over time through poor posture, poor structure, some sort of compensation, or even repetitive patterns in your everyday life. It could be a mother carrying a baby on the same hip every day, a dentist leaning over patients for years, someone training hard with poor mechanics. So the body adapts to these patterns slowly, and eventually that compensation becomes some kind of compression, and that's when pain starts to show up. So a great example of this is SI joint pain. The SI joint, okay, is the connection between the pelvis and the spine. And usually that problem doesn't start there because most of the time the body slowly shifts out of alignment from the ground up. The feet collapse, especially one side more than the other. One of the arches changes, the hips shift, and the pelvis rotates. And over time, that compensation builds into lower back and SI joint. So people then will stretch the symptom. But stretching usually only creates a temporary relief because the structure underneath hasn't changed. So first we need to restore the awareness. Then we have to talk about a lower limb fascial release. And then it's reinforce the structure with deep lower abdominal and pelvic connection. And you do that through breath and lumbar positioning. Not endless crunches and random planks, but a real connection back into the pelvis and the spine. Because pain is rarely the problem where it actually begins.